So in this video I'm going to take you through how the 4Ds of diagnosis can help us diagnose mental disorder in a fairly crude and simple way. We're going to be looking at some more sophisticated methods later on, but we're going to start with these 4Ds. So one of the most difficult things to do in mental health is to try and diagnose mental illness correctly. It's a really challenging problem and has led to lots of misdiagnoses, and that leads to lots of treatments which don't work or actually can be positively harmful. You're going to learn about a number of tools and techniques that psychology and psychiatry has developed, but one of the most important is to ask whether behaviour fits into one or more of these four categories. Is that behaviour deviant? Does that behaviour cause distress? Is that behaviour dysfunctional? And is that behaviour dangerous? Now, these are very crude methods, they're very crude words, and you can probably see that they're a little bit judgmental in some ways, so you're probably thinking, actually, this is wrong anyway, but bear with it, and hopefully you can see that they do have a contribution to make to diagnosis. So let's start with deviance. So this is a behaviour or emotion that doesn't fit into the norms of a society and crucially isn't considered acceptable in that society. These norms could be social, they could be cultural, they could be a bit of both. So things like behaviours like paedophilia and psychopathic behaviour clearly aren't acceptable, and they go against social, cultural and legal norms as well. However, being a genius might not be normal, but it is acceptable in society. So in other words, this particular diagnosis relies on what we see as being a norm in society. Another way of defining deviance is to look at statistical deviance. Now, you've met standard deviation before. Most people fit within one standard deviation of a normal curve, so approximately 68% of people fall under that one standard deviation, plus or minus the mean. So deviance is sometimes defined as behaviour outside two standard deviations from the mean, so plus or minus two standard deviations from the mean, and what that gives you is approximately 4.4% of the population. So here are some graphical examples. You've got the Joker in the middle with his fairly abnormal behaviour. You've got rioting at the top right hand corner. You've got somebody feeling out of place and very different, deviant from the rest in one term, if you like. And then you've also got the statistical definition down there as well. You can see that in terms of the normal curve. This is a very controversial definition of abnormality, and it's worth bearing in mind that what is deviant for one person or one culture or one society is not going to be necessarily deviant for another person or another culture or another society. Let's have a look at distress. So this refers to the negative feelings that somebody with a mental disorder might be experiencing. Those feelings can prevent an individual from functioning in their everyday lives. The most obvious example is probably depression or anxiety, but in depression's case, where a sufferer experiences low mood. Distress doesn't have to be just low mood or depression. For example, a patient with a phobia of dogs will certainly experience fear and upset when confronted with a dog. Distress doesn't always interfere with everyday functioning. You might feel a low mood, but you can still go to work, you can still go to school, you can still revise. So it doesn't necessarily stop you from doing the things you want to do, but it is very upsetting while you're trying to deal with that distress. Okay, what about dysfunction? Well, this is when a behaviour interferes with everyday life and tasks. So, for example, trying to hold down a job, looking after yourself at home, or eating healthily, going to college or school. A person might be considered to have dysfunctional behaviour if they can't perform such tasks or they can't cope with everyday life. The definition can also include unpredictability of behaviour, irrational behaviour, suffering, or violating moral standards. Dysfunction is a little bit more objective than the social standards that we use in deviance, but it ignores the fact that the behaviour we label as dysfunctional might actually help that person. So, for example, somebody taking drugs, well, that might behaviour might be seen as dysfunctional, but it actually might help the individual cope with their lives. Another example, not on the slide, is depression. And some people have suggested that depression actually is a form of functioning. It might prevent you from undertaking everyday tasks, but it actually acts as a call for help to others. And finally, we've got the fourth D, which is danger. And in this case, the question you have to ask is, does the behaviour cause or potentially cause harm to the individual or others around that individual? The basic idea behind this D is that you have the right to behave the way you want to, so it's more liberal than social deviance or dysfunction. So in other words, you can do what you like, but you don't have the right to cause harm to yourself or to other people. And yes, okay, this bit's a bit silly, but I certainly couldn't resist, especially with Danger Mouse. So that brings us back to the very first slide we looked at in this idea of the 4 Ds. We've got deviance, distress, dysfunction, and danger, and it doesn't matter which order you do those in, but there's one thing I just want you to think about. There might be a 5th D floating around here, and that might be duration. And I'd like you to think about why that matters. Why does duration, time, matter for a disorder?